Thank you for the introduction. I will go through some basic statistics just to set this scene, and then most of my presentation will be about the NHS duty of care to Black and ethnic minority staff, especially during the COVID-19 pandemic. 40% of doctors and 20% of nurses in the NHS are from BAME backgrounds. So overall, we make up about 20% of the workforce. And there is no doubt that BAME staff do contribute to the strength and diversity to healthcare and offer immeasurable value to the NHS. We're all aware of the grim statistics during this pandemic. We showed that 2/3 of healthcare staff who died are from BAME background. Black males were 4 times more likely, and black females 3 times more likely to die than their counterparts. And we do know of countless colleagues who ended up in high dependency unit or ITU. Other risk factors included older age, male sex, and pre-existing conditions. And this is happening in a setting where the Workforce Race Equality Standard of 2019 showed that BAME staff were more likely to report personal experience of discrimination, and they were more likely to face formal disciplinary processes rather than informal processes. And in addition, the GMC published the Fair to Refer report again last year. We showed that BAME doctors were less likely to receive constructive feedback, and many reported difficulties accessing leadership team and being heard. And the blame culture exacerbated the feelings of being an outsider, and many reported facing bias and stereotype. So when you add these prevailing conditions to the COVID-19 pandemic, and we know that in the context of COVID-19, there is an inherent level of risk for all NHS staff who are treating and caring for patients. So it's not surprising that some BAME staff may feel extremely anxious and stressed. Some have had to deal with death of loved ones and friends, and all this will lead to a negative impact on mental health and well-being. So this leads us to the next question. What is the NHS duty of care to BAME staff during this pandemic, given this prevailing condition? Well, there is a legal requirement. The Health and Safety at Work Act 1974 states, "It shall be the duty of every employer to ensure, so far as is reasonably practical, the health, safety, and welfare at work of all its employees." So it's not a matter of choice. And more recently, NHS employer has reminded organizations of this obligation. There are different frameworks organizations can use to protect its staff. One is the risk reduction framework, and there are 3 aspects to this. So there's workforce placement, workforce assessment. So you take into consideration the setting, whether it's hospital setting or primary care. Review all your error-generating procedures and potential exposure to coronavirus in the workplace. And following these, organizations will try to eliminate, if possible, or more likely, reduce exposure and risk by hygienic measures. And there are clear standards of infection control measures that organizations have to adhere to. For instance, more frequent cleaning of surfaces, safe systems of work, ensuring correct use of PPE, including training staff and making sure that they are fit tested. The second is workforce assessment. The assessments have done organizations now to think about how to mitigate these risks. And for some people, this will mean redeployment or remote working. But for many, it will be ensuring that they have availability of appropriate PPE or enhanced PPE, which is fit tested and are trained to use it appropriately. If you do have to be redeployed, it's important that you have effective induction with regular updates. NHS also has a duty of care to your well-being and providing psychological safety and safe rotas. What is important is that organizations undertake comprehensive and continuous equality analysis, impact assessment on staffing issues, ensuring that they're reviewing the allocation of shifts and access of PPE and fit testing to ensure that no one group is disadvantaged, especially as earlier on in the pandemic, there were anecdotal reports of where people have reported that some BAME staff had been disadvantaged. NHS has a duty of care to provide psychological support, and beyond making access to psychology sessions through occupational health, various ways it provides psychological support include ensuring that there is clear and communication strategy. In times of uncertainty, it's calming to staff when there is honest, open, and transparent messages, so staff are aware of what is known and unknown and what the plans are. This provides some degree of psychological safety. Visible and inclusive leadership that are available and supportive to their staff while guiding them through this uncertainty. So a lot of the communication often in organizations are from the chief executive or the medical director, and this shows that they're leading from the front, especially at this time of uncertainty, providing again psychological safety. I've chosen to share with you a trust bulletin, which is called COVID-19 Bulletin, and it's published weekly. And you'd notice that it's titled Merisicle Operation. Merisicle is a black Jamaican nurse. So again, it's an attempt to show inclusivity. Other ways include enhanced line management. Middle managers have had to have more training to be psychologically informed, so they're able to have compassionate and supportive conversations with staff. There are many examples of good practice in different organizations. Some have set up peer support systems, for instance, shift body systems, so they can encourage each other to take breaks, checking in to see if their colleagues need a chat, reminding them of their going home checklist. So if this isn't happening in your organization, you could try and raise the possibility. Health and well-being. Many organizations have BAME network staff. So again, if you feel unable to speak to your line manager, find out about your BAME network staff, and because this is another forum that you can raise concerns. There have been many NHS organizations that have held staff engagement forums, so they can listen to the concerns of people of BAME origin and hopefully respond to them. There are many resources available to NHS staff, so free access to wellbeing apps, including apps to help you sleep. There is a clear link between physical safety needs and psychological well-being, and this is why many NHS staff provide a free hotel accommodation for doctors if family members have COVID symptoms, so that you feel able to come to work. 24-hour access to psychological safety is important. Many organizations have the freedom to speak up guardian. So again, if you don't feel able to speak to your line manager or the BAME networks, this is somebody else that you could raise your concerns with. So try and find out who your freedom to speak up guardian. Also find out whether your organization do SWOT rounds. These are evidence-based forums for hospital staff from all backgrounds to come together to talk about the emotional and social challenges of caring for patients. They offer protected and confidential forums for this reflection and support. So it's mainly about the non-clinical aspect of patient care. Those that have taken part in this have reported decreased stress and isolation, greater understanding and appreciation of their colleagues' roles and contributions, and feeling more supported in their work. So I will urge you to find out whether these exist in your organization, and if they do, take part in them. Now that we are in the recovery phase, organizations are reflecting on their outcomes, analyzing them, looking to see what could be done better, what could be celebrated. And these will bring up different emotions in different staff. I will urge you up to actively take part in this, as eventually you will get some learning and it will help you psychologically to come to terms with all that we've been through the pandemic. So to conclude, these are challenging times, and it is okay to feel stressed and anxious. We all need to be empowered to seek help, speak up, access available resources to keep safe and sane, keep healthy and updated. We should all be proud of the contributions we as BAME staff have made as individuals or as a group, whether we've worked as a distance or in the front line to the NHS. And the NHS does have a duty of care to its BAME staff. Thank you.